Come in.
Good afternoon, Mr. Green. How are you feeling today?
Hi, I'm good. How are you?
Good. This is Julie. Remember
Hi,
I was
Julie.
talking to you
Hi, Mr.
about...
Green, how are ya?
Good.
So Julie is going to be your nurse for this evening from 3 to 11. I am off. I just gave him Dilaudid 0.5.
Okay.
About 2 o'clock he was complaining of pain in his right foot. So I gave him that. So John is a 35-year-old male who was at home on Friday and noted a wound on his foot, right?
Yep.
And your leg was starting to get red, correct?
It was, yeah.
It was.
And it was itching and skin was getting all cracky and ugh.
Okay. So John came into the ECC and they admitted him to the floor. Dr. Fuller is his doctor. John is scheduled to go for surgery tomorrow with the vascular surgeon, Dr. Byrne. He's having a transmetatarsal amputation tomorrow.
Oh, okay.
So the consents still need to be signed. John's supposed to have labs in the morning, and his wound care on his right foot is just a dry sterile dressing with betadine paint. I did do this this morning. It's twice a day on his left great toe. There is some areas of necrosis that are present, so we're just trying to keep it dry for surgery tomorrow.
Okay.
So John is on a 75-gram carb diet. He is to be NPO after midnight. We did discuss that on the board.
Okay.
So get your food in before surgery because we don't know what time you're going yet.
Yeah.
So, okay.
Maybe steak later, huh?
We'll see what's on the menu.
Yeah. So John is scheduled to get Zosyn at 1600.
Okay.
He also gets vancomycin, which is every 24 hours. I hung that this morning.
Okay.
He has a number 20 right forearm crimp.
Or they changed it, remember? They put it over here.
Left.
Oh, the left.
Yeah, that's
Sorry.
okay. That it was in my right.
It
and
was.
then the
You're right.
nurse come in.
I wrote down right and it's in the left. He has point of care, one touches,
Okay.
ACHS. He was 140 this afternoon. He's doing pretty good. No coverage needed. He ate pretty much all of his breakfast, all of his lunch. He has great appetite. He is independent in the room. His vital signs are stable. With John's assessment is pretty negative. Heart rate's regular, lungs are clear, positive bowels. Little thready on his right foot,
Okay.
but other than that, unremarkable. He does have a little fall risk, about a 6, because of the medications that he's getting. But he is independent. He will ring if he feels dizzy. We talked about that this morning, how if you start feeling a little lightheaded, especially after the medication, you just call us and we'll come in and help you to the bathroom.
So, Mr. Green, when I'm done getting report on the rest of my patients, I'll go ahead and grab that consent and I'll bring that in and we can go over that for your procedure tomorrow.
Okay.
All right, and you were medicated with some Dilaudid prior to me coming on. How are you feeling? Is that holding you okay?
It's,
Do you
yeah,
feel
it
that
feels good.
that's an appropriate dose for
Yeah,
you? And
feels
where would
good.
you rate your pain at this point?
Like a 2.
At a 2, okay.
Yeah.
So I'm going to go over here and update the whiteboard. Again, my name is Julie, and I will be here from 3 to 11 tonight. So we have a goal here of 4 for your pain. So you say it's a 2 at this point, but I don't want it to get anywhere above a 4. So if you start to feel it's creeping up, I need you to call me and let me know
Sure.
as soon as possible.
Absolutely.
All right? Will be doing hourly rounding, so if you need anything, I want you to call me, but I will be back within the hour to see if you need anything and to see if you need to go to the bathroom or anything. Because you have a mild fall risk, I don't want you getting up on your own.
Okay.
Here's your call light. The red button is to push to ring, and I know you've been here for some time, so you probably do know that. All right, is there anything else that I can do for you? I have the time.
Good.
I do want to put in one other thing, so
Okay.
is that we talked about his plan of care.
Okay.
And his plan of care was he wanted to ambulate a little more this afternoon if he could.
But it sounds weird. I just want to like walk on my foot a few more times before I lose part of it.
Okay. All right.
So
And
it's my only goal today.
okay, well that's a
Okay.
good goal, and we'll make sure that we get somebody in here to help you and to be with you while you're ambulating. So we don't want you to put yourself at risk or fall if the pain gets too much where you can't ambulate.
Okay.
Okay? So I'm going to go ahead and sign the whiteboard, and I will be in within the hour, myself or the tech.
And John, you have a wonderful nurse. Julie's been a nurse for 13 years, so you're in great care.
Great, good to hear.
Okay,
Mr. Green.
All right.
It was a pleasure taking care of you. Good
Thank
luck with
you.
surgery in the morning.
Thank you so much.
Right.